Welcome to Partners in Health and Biz with your host, Wendy Meyerhoff. Tune in every Saturday, 9 a.m. for great shows about obtaining and maintaining health, business, and finance. Learn from the experts here at PIHradio.net. And now, broadcasting from the Partners in Health and Biz studio, here's Wendy.
Gail, and in case you didn't recognize that voice, that is my partner and co-founder of Partners in Health and Biz, Gail Dixon. So thanks again, Gail, and welcome to today's guest.
This is Diana von Briesen. Diana is an amazing real estate lady, and I speak from my own experience because, God bless her, she helped get me and my hubby into a Baltimore condo late last year. She is serving the greater Baltimore area through the Forsyth Real Estate Group. And so what we're talking about, even very briefly, is the fact that you can be working from home as a healthcare provider, whether you're the primary setting up a true home-based examination office or whether you're doing massage therapies and yoga instructions. But you have to obviously find the right place and figure out what you need and so forth. And I'm going to give you a quick bit of information. I looked up some stats. Nearly 3% of the total U.S. workforce telecommutes at least half the time, according to Global Workplace Analytics. And since 2005, the total number of employees working from home at least half the time, not even full-time like I do, at least half the time has grown 103%. And this is from Health Leaders publication online. And this is they're just talking about hospital workers making the trend to being able to telecommute in certain ways. But as I said in the intro, Diana and I are not here just to talk about nurses and doctors, but anybody who works in any aspect of healthcare. So I remember, Diana, you telling me that buying a home can be one of the most stressful things we'll ever do. So what happens when we're not just buying it for personal reasons, but we want to include some kind of business option, whether it's just setting up an office to do our bookkeeping and social media posts, or we're really doing the whole practice there. What makes it so stressful about adding that in?
Well, so you can't just pick a home and throw a business into it. It's a little more complicated than that. And anytime you're making things more complicated, it adds stress. You have to consider how large your home business is going to be. Are you going to be bringing clients into your home to provide your services, or are you doing something like a telecommuting job where you can just have an office, a room in a house? And so once you get into how large the business is, then you have to figure out if the area that you're wanting to move to is zoned to allow businesses in homes, and then you have to figure out if you're allowed to put up signage, if you're going to need more parking, if you're going to need a separate entrance, and all of those things just reduces the pool from which you get to select your home from. Right now we're dealing with inventory that is the lowest it's been in a decade, and it makes it even more difficult. So, you also have to consider financing, and you also have to consider affordability. So all of those things add stress to the process that's already stressful.
Yes, I remember it was great fun, and thank God we had you, Diana, because it just as they always say, it is stressful finding the right place. And we're talking to healthcare pros. Are there any kind of business needs they might be expressing when they're, what are some of the things you may have heard? As I said, maybe we need a separate room, or we only want to work in the basement. What are some of the things, whether they're health professionals to whom we're speaking, but it could be any small home-based business?
Right. So I've heard from people that have been interested that they want to be able to have a separate area with a separate entrance. That's something that has come up multiple times. Excuse me. They're also interested in how it will affect the rest of the house, like flow, if they've got kids, how do they keep their kids separate from their clients if they're doing that. Sometimes it comes down to, is the house set up to handle equipment that requires electricity or Wi-Fi or connectivity. Those things can be issues. I know that you guys have run into some problems in your condo, even with connectivity.
Yeah, here's an announcement for Comcast. We still can't get our printer to work properly, folks, so we're not happy.
Yeah.
But yeah, I mean, especially if you've got nice money, but you're in an area with these elegant homes and they were built 60, 80, whatever years ago, the wiring. It's one thing if you're a yoga instructor, you got to put down a mat and play a radio. But if you are really going to do in-depth work, I hadn't even thought of that. If you've got any x-ray equipment or even just the basics, if you're going to set up a dental unit, I can't imagine the wiring and all that kind of thing.
And so really, depending on what you want to do with your home business, with your healthcare business, you do, the best thing you can do is let your realtor know the scope of your business and your idea, because you're never going to be able to just pick any residential neighborhood and let's pick on the dentist, throw a dental office in it. You've really got to make sure that you're in an area that makes sense. So location is important. Do you want to be near a large commercial area? Most people, when they're buying a home for themselves, don't necessarily want to be in a busy area. They want to have quiet. Main thoroughfares are not as desirable. However, you're putting in a home business. You want people to see you. Being on a main thoroughfare is something you should consider. So having a good discussion with your real estate agent will really help them narrow down the possibilities for you, and then have a clear idea of the path that you want to take.
Now, we mentioned very briefly my moving into a condo thanks to the work you did through and as part of Forsyth Real Estate Group. But I'm a New Yorker, transplanted to the Baltimore area. I'm used to apartment buildings. I love an elevator. I don't have to shovel snow. And we are on a somewhat busy street. We've got two fairly main streets intersecting right near us, but we know how to cope with this. So as you say, if you want to get into that kind of a building, and that's not just the location, it's all the rules and regulations. If you think just getting a mortgage is fun, now you got to add in all the condo rules and regulations. Will they even let you have a health-based business at home, or any kind of home-based business? And if so, what is it? Because if it's anything where you're bringing in traffic, my business doesn't bring in traffic as a health communications strategist and consultant. But if you're going to bring in people who are patients, who are getting their massage therapy, if you have whole groups for yoga, that's a whole different kettle of fish, right?
Oh, absolutely. That's a really good question. Condos and even some HOAs, homeowners associations, have very specific rules about what you can and can't do in your space. So if you were considering purchasing a condo in a building where you feel like you could really provide a service, you would need to make 100% sure prior to purchasing that condo that the condo doesn't have rules against it. They generally want to know who's in their building, and so do the residents. I mean, clearly most large condos have front doors. They have, a check-in system. They have parking that's, set aside for visitors. But they generally don't, in my experience, want tons of traffic for people who don't live there in the building unless you're a guest or something. So you would need to make sure that it is permissible. Now, in some condos, like say in Towson, they have a floor or two that's set aside for businesses to put up, to have shops set up in their condo lobby. So that is something that you could potentially own a condo in the building and rent retail space down below. Now, that could be expensive and prohibitive, especially if you have a more consultative business, maybe like somebody who does acupuncture or somebody who does yoga or Reiki or, all the different kinds of services there are for people. You don't necessarily need a space where you're paying rent 100% of the time because you're not using it 100% of the time. There is an advantage to having a home business where you're living in it, you're getting the use out of it, you have your space set aside for your business, and you can have people come to your home and you can provide those services without having the overhead costs involved. So condos can be a little tricky. And it's better
or even townhomes from what you're saying, right? Because that's where the HOV comes in.
HOA, it's the homeowners association.
HOA, well, whatever. I told you I don't understand the real estate side, and thank God I had you, Diana von Briesen, because otherwise I was cockeyed enough as it was.
You weren't that bad. You were fine.
Oh, thank you so much.
Right, yeah. The point is you should really make sure that your agent helps you do the due diligence that you need to do before you sign that contract.
And now you can do at least, and you should do some of the research on your own. Now, especially now with the internet, it's not just when we were reading classified ads in the newspaper or in magazines and saying, hey, here's this house over in Pikesville or Lutherville or in Baltimore, Annapolis, whatever. You get the local stuff, you see what's out and around, and okay, but I heartily urge people to go up online and find out what is an HOA and the pros and cons of condos versus single family, and where can you get help from the Veterans Administration. My husband's a vet, but unfortunately the VA doesn't believe in condos as part of their mortgage rates, which I was pretty sure of, but I looked up and checked it, and sure enough, nope, not. But with a nice single family and you're a veteran, you can get some amazing rates.
Sure, you sure can. A VA loan is a very, very safe loan for veterans. I know that the government takes a lot of measures to protect the veteran in the purchase of that home, and I think it's a great thing for people. I know that my husband, as a former Marine, has used his VA benefit to purchase 2 homes, so I can't say enough good things about it. I wish they would do condos. That would be great. It would make sense.
And especially with an aging population, as people are leaving single-family homes and maybe going into townhomes or smaller apartment-type things where there are elevators and you're not doing your snow shoveling and all that kind of thing. A note to the Veterans Administration, look more in depth to this. You got aging vets already, and you're going to have more of them very shortly, so I would heartily recommend this. Okay, so believe it or not, unfortunately we had Blog Talk Radio difficulties, so instead of our full half hour, we got about 5 minutes left. How do I find a realtor like you, Diana? What's the best way for me to find the right person who's really going to help me, my family, and especially with this extra addition of not just finding the home, but figuring out if it will really work as a home-based health business?
So there are a couple different ways. One of the things you have to remember is that there are over 26,000...
Say it out, Diana. Speak loudly.
Okay, I'm sorry. One of the things you have to remember is there are over 26,000 realtors in Central Maryland alone. There are a lot of us. So it's going to be, if you can lift up a rock and you'll find a realtor. I mean, they're everywhere. So that's my attempt at a joke. What can I say?
Okay, I liked it. Not sure the Realtor Association will, but I liked it.
I don't mean it in a negative way. I mean, we're everywhere. So, I mean,